Hi, this is Dr. Rodger Murphree, thefibrodoctor.com, author of Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome. I've been in private practice for 24 years. The last 18 years I've specialized in fibromyalgia. The majority of my practice these days is phone consults, and I get to work with patients all over the world. My book, Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome, is now in its 5th edition and available at most bookstores, including Amazon.com and BarnesandNobles.com. One of the things that I see with fibromyalgia is just the craziness with all the medications that my patients are taking. It's not unusual for my patients when they first start with me to be taking half a dozen to a dozen different prescription medications. And one of the challenges with being on all those medications, you don't know whether those medications are actually doing anything. Are they helping or are they hurting you? Because every prescription medication has a potential of having side effects. You look at the potential side effects of Ambien. Ambien can cause diffuse achy muscle pain, problems with mental clarity issues, fibro fog, right? It can cause you to have poor memory, low moods, problems with coordination or balance issues. So if you're taking if you have fibromyalgia and you're taking Ambien, you may not know, is it the fibromyalgia, maybe you're having a flare-up, or is it the Ambien that's causing you to have problems with balance issues to where you're falling over or not being able to feel like you're steady as you'd like to be, or maybe having issues with fibro fog or the diffuse achy muscle pain that's so common with fibromyalgia. Is it the fibromyalgia or is it the Ambien that's contributing to that? So every drug has a potential side effect. And in my book, Treating Beating Fibromyalgia and Chronic Fatigue Syndrome, I talk about all the different things that are roadblocks for you to get well if you have fibromyalgia. One of those things is you need to really know what your drugs are prescribed for and then what are the potential side effects. And you'll have to work with your doctor to wean off those medications if you so to choose to do so. However, what I find is that most of the time my patients are on numerous drugs and they don't even know is the drug helping or not, because again, with fibros you have good days, you have bad days. So you may be taking Lyrica and Celexa and Cymbalta and these different medications, but are they helping? What happens is typically you go back to your doctor or doctors plural a lot of times, and every time you do, because you're not really doing that much better, they'll add another drug. And again, pretty soon, because you have so many symptoms, and what traditional medicine really does is really try to treat the symptoms, not really the causes. What they try to do is to reduce those symptoms so they're not bothering you. Then they'll put you on another medication based on the symptom. Well, with fibro, there's so many symptoms that it's not unusual, again, that you're on half a dozen to a dozen drugs. I'd like for you to join me each and every Tuesday night for my teleconferences, and I've included in this presentation here an audio of a past teleconference I did where I go into each drug category, the cardiovascular drugs, the antidepressants, the sleep medications, and I go into detail about those medications so you can learn about what those medications do and the potential side effects, and see if any of the medications that you're taking can actually be causing some of the problems that you're experiencing with your fibromyalgia. This is Dr. Rodger Murphree, thefibrodoctor.com, author of Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome. I look forward to your questions each and every night on my Treating and Beating Fibromyalgia teleconference, and you can learn more about that at endfibronow.com.